MySpine. 80% of the active population in Europe suffers from low back pain at some point in their lives. Surgical treatments lead to satisfactory short-term pain relief, but the long-term outcomes are still inadequate. To improve healthcare and reduce economic costs, surgeons must be able to make an accurate diagnosis to perform the right treatment for each particular patient. MySpine aims to create a clinical predictive tool that will help to determine the best treatment for low back pain. To do this, it will provide clinicians with patient-specific biomechanical and mechanobiological analysis. MySpine begins when a patient with low back pain is sent by his general practitioner or surgeon to perform a computed tomography and magnetic resonance imaging scans of the lower spine to diagnose disc degeneration. Then, the medical images obtained from the scans are sent securely to the MySpine platform to create a 3D model of patient's lumbar spine, including the bones, invertebral disc, ligaments, and muscles. Next, a biomechanical analysis is performed to predict the load transfer onto the discs and vertebrae. The evolution over time of the possible degeneration of the adjacent discs and of the remodeling of the vertebrae is simulated. Several clinical scenarios are considered. Without surgical treatment, that is, using a conservative treatment such as physiotherapy, or with surgical treatment, such as discectomy, a procedure which consists of removing a fragment of herniated disc, or spinal fusion, a technique that rigidly fixes the vertebrae to avoid disc compression. Lastly, the patient-specific predictions generated by MySpine are made available to the surgeon through a user-friendly and interactive graphical interface specially developed for the platform. Although the surgeons will ultimately decide what is the best procedure for the patient, their decision will be supported by the information received from MySpine, making it much more likely that their choice is the most satisfactory with regard to the future quality of life of the patient. MySpine will be the first patient-specific platform to predict tissue evolution during the chosen surgical treatment and subsequent rehabilitation activities. Although MySpine focuses on disease of disc generation due to their prevalence, the developed prototype system will be able to analyze other spinal pathologies as well.
MySpine will clarify the variables affecting the decision-making process, and the development of a user-friendly software will help the medical decision using a risk estimation based on the biomechanics of the disc degeneration. With the MySpine software, surgeons will get a valuable tool which provides evidence-based data on the patient's individual spinal mechanobiology. In this software environment, we will be able to model not only the individual spinal biomechanics, but also the effect of the different surgical and non-surgical therapeutic options, which can help to choose the optimal, personalized intervention resulting in the best achievable clinical outcome.